Hello, I'm gonna talk about tooth supportive structures, or this is first part of periodontal introduction of periodontal diseases. So we're gonna talk about anatomy. Here is one tooth in his alveolar pocket of the bone. Let's say this is the mandible, and I'm gonna say mainly the main structures of the tooth and also the supportive structures, and after that I'm gonna explain them in details. So we have the bone. Let's say this is the bone. This bone has spongious part. Let's say it looks like lots of radiolucent parts here, like little dots, which you can see on the X-ray. And this is the spongious part, and the cortical part of this alveolar process in which the tooth is situated is here. This is the cortical part. This cortical part is called lamina corticalis. Also, lamina dura looks like a very thick line on the X-ray, radiopaque thick line, and this thick line actually it's more has more inorganic part in itself. The bone is composed of 2/3 inorganic, calcium and phosphate, and 1/3 organic part. So in this lamina corticalis there are millions of small canals situated here. Small canals. So that's why when you look at it with microscope, it looks like this. Let's say this is lamina corticalis when you see it from this side of the tooth. So this lamina corticalis have small rounded canals, as I said. Here, small rounded canals. So that's why this lamina is called also lamina cribriformia. Lamina cribriformia. Here, this small space between the alveolar interdental alveolar part and the root of the tooth, there is periodontal space. This periodontal space is normally 0.25 millimeters in extent here. This space here is that white. We have cementum. This is the cementum, which is surrounding the root bulb. This is the root bulb, the coronal bulb. So the cementum is forming the roots. We thought that this is the dentin here. It is composed of a lot of tubules, dentinal tubules, which goes like this. Imagine tubules, and this is the enamel. Is the most hard structure of the tooth. It's very resistant structure. So this periodontal space is filled with a lot of cells, also periodontal ligaments. These periodontal ligaments are composed of collagen, and they have different direction in different parts of the tooth. These fibers, collagen ligaments, are composed and they are produced by fibroblasts. Fibroblasts are one of the cells of this periodontal space here. Except fibroblasts, there are osteoclasts and osteoblasts also. There are different immune cells like neutrophils, monocytes, lymphocytes, T and B, antibody cells, and when there is inflammation, there are also bacteria. So dentin and cementum are totally different structures. Cementum is less resistant to any bacteria. It is less has less protective function than the dentin. So here we have this enamel-cementum junction. Sometimes this enamel-cementum junction is exposed when there is recession or some destruction of the gingiva, and we can see the place where the enamel connects with the cementum. There is different types of enamel-cementum junction. When the cementum goes over the cementum, when the cementum goes over the enamel, and when the enamel, between the enamel and cementum, there is dentin here. And that's why some patients, when there is recession and they have hypersensitivity to cold or to hot drinks, and so it's very unpleasant sensation, and should be taken some actions in this case. The periodontal space here, the fibers, they have different direction. So we have radial, oblique, horizontal, and apical fibers. So the radial fibers, they react against the lateral movements of the tooth in vestibular oral direction, or even in mesial or distal direction. As you know, most likely the tooth can move to the mesial side of the dentition. When there is a missing tooth, let's say this tooth is missing, it's very likely so this tooth goes in an oblique direction or migrates to the side of the missing tooth, and there are some changes in the bone because of this. Let's say the tooth migrates to this side, so there will be a resorption in this place, and there will be bone opposition or production of bone in this place, and this is made by resorption by osteoclasts and reposition by osteoblasts. So I'm gonna tell you about dentin. You know, this is the dentinal tubules. They are filled with fluid which has hydrostatic pressure inside, and some nerve fibers inside of these tubules. So that's why when there is recession and the dentin is exposed, because it's more prominent to any sense reactions, so there might be pain because of these nerve fibers inside of the tubules, which are provocated by cold, hot, or some other chemical or mechanical irritation. Cementum. So cementum, there are two types of cementum. The first is primary and the second is secondary. Primary, as the name shows, when the roots formate. There is 3 years until the root formate fully after the eruption of the crown. When the crown erupt, so we have 3 years for the root to formate. The primary cementum is mainly composed of acellular. It's acellular, or I will write it here. Cellular, and the secondary is cellular. The cells which are producing cementum are called cementoblasts. So I can tell you about blood supply of the periodontal supportive structures. Blood supply comes for the mandible from alveolaris inferior, arteria alveolaris inferior, and for the maxilla from arteria alveolaris superior, which has 3 branches, and also from arteria infraorbitalis. Also there is blood supply from the bone, subperiosteal, and also subepithelium from the gingiva. There are plexus subperiosteal and plexus subepithelium. So I'll tell you about alveolar bone. It is has some canals. These canals, as I said, they are called Folkman canals. And there are some Havers canals. The spongios. So the spongios and corticalis. The corticalis is lined by periosteum. This periosteum is very highly innervated structure, very sensitive, and also there is endosteum. It is more like elastic, and so these small spaces here, there is brain stem, which is, and here is in these canals there is the vasculation of the alveolar bone. So I'm gonna tell you about gingiva now. We have different types of the gingiva. So as you see, this is the interdental papilla. We have also, here is the marginal gingiva, and this marginal gingiva is situated a little bit above the enamel cementum junction on or on it usually, and the pocket which the free gingiva, there is free gingival margin here, which is deep about 0.5 to 1 millimeter. Then we have attached gingiva, and it's situated above the cortical bone here, above the vestibular bone, and it's called attached gingiva. Now we have marginal, attached gingiva, and here and on the bottom, in the vestibular and the lingual direction of the tooth, there is a mucogingival junction. Let's say here somewhere. Junction. And let's say this is on the mandible. This is a molar. Here we have the free gingival margin, marginal gingiva, attached gingiva, which is attached to the cortical, to the bone, vestibular part or lingual part of the bone, and then going apically we reach the mucogingival junction. So the attached gingiva is usually keratinized, and in the place of free unattached gingiva is unkeratinized. So in normal cases, when the tooth supporting structures are healthy and there is no pathological process, this free unattached gingiva, this pocket which is formed by the tooth structure and the gingiva, it is deep about 0.5 to 1 millimeter and is measured by probe. There are different types of probes. So in the mouth there is lots of bacteria, millions, thousands of bacteria, and when we don't take care, we don't have proper oral hygiene, these bacteria form plaque. This plaque is like a film on the surface of the tooth. Here I show it. So the first few days, like 2 to 4 days, with no oral care and no tooth brushing and cleaning of the teeth, we have the first layer here. This first layer contains of mostly gram-positive bacteria, streptococci, staphylococci, and so on, and they are aerobic. They use oxygen to live. So after more days, like 5 to 6 days, there is a second layer, and this layer is mostly with Fusobacterium and Porphyromonas. The third bacteria are spirochetes, spirils. I'm gonna write them. heads. And the 4 layer, when there are few layers of bacteria base, the 4 layer, it is becoming gram-negative. So this gram-negative, let's say it's mistake. It's 1, 2, 3, and 4, because the most deep layer becomes anaerobic. These bacteria, they don't need oxygen. They are gram-negative, and they are extremely bad for the tissues, for the gingiva. The gingiva have very strong reactions to them. So I will tell you about natural, when do we have more plaque development. Usually after we brush the teeth, like even few minutes, like even 1 hour after we brush the teeth, there is a so-called pellicula. It is very thin layer on the tooth, which is formed, and it is mainly based on sorry about this mistake here.